Hello, I'm Dr. Delp with your tip of the week. I've had a lot of patients asking me about blood pressure. What natural supplements can they take that will help lower their blood pressure? We all know about sodium and sodium's effect on causing blood pressure to rise. But keep in mind, if you do not have blood pressure, sodium is not a bad thing. In fact, sodium is a very natural thing. We need sodium. Of course, not mega doses of sodium, but for the most part, you do need sodium to survive. But if you have high blood pressure, sodium itself will lower your blood pressure just by on a sodium restrictive diet. 10 points on your first number, which is systolic, and even 5 millimeters of mercury on your second number. But some other supplements that can also boost you is magnesium, which will definitely make a big impact. Potassium can lower 8 points on your systolic and 4 points on your diastolic, your second number, which is actually better in some, or almost as good as just a sodium restrictive diet. So if you add those in together, now we're talking. Another great supplement that's good is omega-3 fatty acids. Will lower it. It'll lower 8 and 5 as well. And then another great one is garlic. You should have garlic in your diet on a daily basis. It'll actually lower it 8, believe it or not, to 16 millimeters of mercury on systolic, and 7 to 9 millimeters of mercury. And that's how they measure it. When I say millimeters of mercury, that's how they measure it as far as in the pressure. But amazing, and believe it or not, coenzyme Q10, as long as you're getting a good supply of it. And unfortunately, the box stores have been, and one of the big nutrition stores have actually been busted recently for having nothing, absolutely zero in the product that was on the label. So just be cautious and buy your supplements at a good place. We carry them in our office, but also there's some other good herb shops around. Just make sure it's not a chain store. I don't know of any chain stores that I really am confident in as far as buying supplements, and definitely not supermarkets, big box stores, things like that. But coenzyme Q10 will lower it 17 millimeters of mercury off your systolic, 17 points, and it'll lower it 10 millimeters of mercury off of your diastolic. So we're talking about big changes. If you add coenzyme Q10, magnesium, potassium, garlic, as well as omega-3 fatty acids, now we're talking. You make it could, and once again, I'm not telling you over your computer to get off your blood pressure medicine. But if you were wanting another option and you feel confident that you can do that, these are some things to equip you that can help you to pull through and make a difference. And that way, if you want to be off some of the medications that can cause side effects, it gives you another option. Thank you very much, and this is your week's tip from Dr. Delp. Thank you very much.